Good morning, everyone, and very nice to see you here in Southampton. And actually, this is our second in-person conference for our Future Blood Testing Network. And last year, we had a fantastic one in Reading, and this autumn, we are having here in Southampton. And thank you, everyone, for attending. Lovely to see old faces from old friends and faces from new friends as well. So I'm going to have a quick overview and recap of our Future Blood Testing network. For those of you who it's first time for you to attend our network, I just quickly give you an idea about what our talking about in our network, our grand challenges. So our network was established in 2021. It's now two years old. But initially, our idea is starting from the time when pandemic comes up. And then we are thinking about, so how can we get the testing done without the patient going to the hospital? How can we monitor the patient more effectively without attending to the acute clinical settings? So, and then we think about blood testing. That which is the most important common types for the medical test, and also that we determine quite a lot of, like 95% about clinical pathways based on the blood test. But how can we have the blood test more efficiently, and also can help more effective early detection of the disease, and also more effective disease management? And then especially when NHS starting to have digital-first strategy and also the virtual ward strategy as well. So the remote blood monitoring could be a very good solution for this NHS strategy. So our network is really looking into the solution that, for example, enable the patient to carry on their own tests remotely. Not just the clinical virtual clinics about consultation, but also maybe the remote testing as well. So that will be able to speed up the decision makings and also become more personalized analytics for the detection or more personalized disease management that can finally lead to the personalized treatment. So how can we have that vision? There are a lot of challenges, technical, adoption and the healthcare challenges we have to solve. So that way we need to build a multidisciplinary community to develop the technologies and with the vision of the remote, rapid, affordable and inclusive monitoring and more personalized analytics. So a lot of technology going on, and we already have a group of really fantastic researchers, also including clinicians, patients, and also the industries coming together to look at this. And just a recap of our approach, our vision. So we're really looking into the three end-to-end inclusive monitoring that have a focus in the community rather than acute settings like inpatient. We are looking at a more community-based care. So especially when patients are at non-clinical settings, how can we remote monitor the patient or remote outpatient blood testing outside hospital, and how can we analyze the data from the remote testing and, for example, on-device or cloud-based analysis. How can we manage those data from the remote blood testing through a secure ICT infrastructure, and how can we have secure data connectivity and with hospital NHS systems that can be embedded to the patient pathway. And then all of the data, including the blood monitoring, electronic health record, because we have more and more data coming in. So how can we use, for example, multimodal data to provide more personalized analytics? Because every patient is different. So with the more data coming, so how can we get our model and our decision support more personalized to a different patient group? So we're also looking at different clinical areas. So for example, the autoimmune disease, cancer disease, there was a lot of projects going on around that need a lot of blood testing for the early detection and also need a lot of monitoring for the disease management. So that is the approach we are looking at. So in the end, we are thinking in the future we will have like new digital system support real-time monitoring for the disease detection and management for the health and the care. So I'm not repeating too much on that, but you might have already seen these key technical areas in our network. So remote monitoring, so for example, sensing a point of care. So we have quite a few colleagues working on that, and also imaging, optics, biochemistry, and also affordable portable devices, point of care devices. So how can we have the more portable, affordable devices to have a remote blood testing? So that's about the remote part. ICT, digital part. So that's more about connectivity, security, and also the electronic health record and the digital system that already exists in the hospital, and interoperability between our monitoring device with the hospital system. So they're very complicated, a lot of standards in the NHS, so we need to be aware of that. And also how can our device be compatible to our ICT system in the NHS, in the hospital. And the last one is, and also quite a popular one, is AI and the personalized analytics. So that is really about, so with the longitudinal data, if we can monitor the blood changes and biomarker changes over the time, can we have a more personalized model for different individual, different subgroup of patients, a different individual that will be able to provide more personalized support. And I was talking, another area would be the diagnostics. So I was in another conference last week, talking to different patients. So if you're like looking at how they think about AI. So we were initially thinking they may concern about data, they may concern about privacy, but it's quite interesting. They prefer AI than the testing. So because AI is non-invasive, so they don't like the invasive testing and the blood, fingerprint, even if it's simple, but still be a little bit like a harm to the body. But so they're thinking if AI can already collect so much data, find the bad pattern that can give you early detection or diagnosis without in non-invasive way, they would prefer have AI, very happy to have AI for the early detection pathway. So then I'm thinking, so can AI become a non-invasive diagnostic tool, especially for the disease that does not have any diagnostic biomarker. So that's a kind of thinking could be interesting for us to think as well for the AI topic. And this last year, so we have the lovely picture here. So we have colleagues attend our in Reading. And in last year, our theme is about the challenges, opportunities. So we talked about a lot of challenges from patients. Well, some challenge actually from interoperability, communication, data with the system not talking to each other, and also pathology system. They want to share the information more efficiently from our patients. So the challenge have been talked about in our last conference. And Demetrius is leading the landscape report, so he will talk about more about the challenge opportunities that they found out from their project. But you already have something very overall high-level funding coming out from the research. So I will leave to Demetrius to talk later. Another theme we are having is. Apart from the landscape report, we have funded 8 projects from 2022 to 2023. So one of the key themes we have AI and ICT. So we have, for example, multimodal deep learning for the ovarian cancer. So I think from KCL. So someone has a Hiba. Yeah, Hiba will help to present as well. And another one is AI for the patient with genetic iron overload. That is from Dimitri's team. So 1 week. So that is 2 quite interesting examples of AI in the blood testing to support blood testing. And another thing is the project we funded here, the remote monitoring. So you might have seen we have the myocardial infarction detection device from Brunel University. And also we have rehabilitation technologies, so multimodal blood analysis. And this is more about remote monitoring plus data analytics from Universal's Strathclyde. And also we have from Nottingham wearable autological measurement for blood analysis. So quite interesting different type of the blood monitoring technologies I look forward to coming up. And some other research, for example, the point of care blood monitoring in the testosterone treatment, and also from UCL and Raman spectroscopy for the remote blood monitoring. And Nottingham, I think someone will present here today as well, implantable device for continuous monitoring as well. So they're all different remote blood testing and monitoring technology we have funded. So we look forward to your project, and then I think in our next meeting we will look forward to see some progress and also some exciting results coming out of these projects. And some other work that our sector-funded project is at the real-world applications. So we talk about challenges, opportunity in the earlier stage of a network. We look at the technologies, and now we are looking more about real-world applications. So we cannot just stay in the lab and stay in the data. So how can we bring our technology to the real application? That is the key theme of this conference as well. And we will have Mamta and Elle to lead the panel discussion about adoption of the technology. One of the examples we have is we developed a project funded by EPSRC recently, looking at the advancing machine learning to achieve real-world early detection and the personalized disease outcome prediction of inflammatory arthritis. So this one, we have done the model, but feel like there are a lot of challenges looking to when we bring this model to the real world. So for this one, we are piloting our model in 2 hospitals, Roebuck's and also Oxford. So really looking at using blood testing data together with other data, including the electronic health record, and also including large language model. Well, Bing is here, so he's working on this project. So how can we combine all the different data and also address the data incompleteness, missing data, messy data together to detect the disease in a very early stage? And the second part we are looking at is that how can we use remote blood monitoring together with environmental information, for example, microclimate around this area, local places, including weather and health inequality, to provide more personalized prediction about arthritis flare. So because we look at the patient, each patient have very different trajectory of the symptom flare when they have inflammatory arthritis. It's so different from ethnicities, from age, or from the socioeconomic background as well. So it's so different. But the problem of AI now is that AI is very generic. So they learn from the population patterns, but not really, this population pattern might not fit for each person. So how can we do that? So that is a new project grant we have started now. Another thing is that some other progress in some of the partners, for example, Reading and the Roebuck's Hospital, we are developing Reading Health Data Institute that really looking into real world for healthcare applications and how can we use a health record and remote monitoring data to support patient pathways. And Warwick, I think there are some students from Warwick as well. Dimitris and Mark has established an MSc Diagnostics, Data and Digital Health, very exciting master program in Warwick. Yes, so that is some really good progress in our network. And in international, we also have international activities as well. So we are organizing a track conference in US in early, so with Oxford Immunoalgorithmics, UBC, and Southampton Summit here. So we're having a conference in Higgs, and also we are also having a conference in Stanford next year too, because now a lot more talk about remote monitoring, remote telemedicine, and real-world healthcare. So we are going to introduce our network in US. So in the next year, we will have a lot of activities in the US as well. Yeah, so I think that's all for a recap, very quick recap. Yeah, so I think the future, moving forward, our network has been extended for 9 months as well. So formally will end in 2025, I can't remember, 25 September. So we'll have quite a lot of time to think about the challenge now, technology we have, and maybe the future. That's why we are starting this theme of today is the future of healthcare, and then how remote blood testing, monitoring, and AI can be really adopted, can be really used in the healthcare, and what are the challenges and barriers. So I hope you enjoy our conference, this two-day conference. Yeah, and thanks very much.